So I'm Alfredo Morabia, a professor of epidemiology in New York. Uh, I've been for a long time a historian of epidemiology and its methods, and now I'm the editor-in-chief of the American Journal of Public Health. And for this morning session, which was about going from risk prediction to prevention, I discussed with the organizer, and they said, I could use my two hats. First one, the historian, to tell the story about the origin of this notion of risk. Do you know when the notion of risk was first used? It actually happened in the late 17th century that we had data in order to compute risk. But the notion of risk and risk factor is a quite recent notion that is from the 50s, early 60s. And so I discussed this evolution, and then I told them about my other experience as editor. What are the options to transform the risk knowledge we have into prevention and to reach the goal of this meeting, which is to bring cardiovascular health to all Americans. And so I've discussed the different options. Some think that one size fits all, and so they go for mass prevention policies, and there are examples of successful intervention in this area. And other people that know one size does not fit all. There are different subgroups in the population, and we should adapt our intervention to their characteristics. And in this subgroup, I differentiate two, I would say, philosophy. One is called intersectionality. And it tells, we have to understand better the subgroups in order to be effective in acting. And it's not about interaction. It's about understanding their daily experience. And the other group is more in this area of precision medicine, precision public health, which aims to identifying subgroups in which specific treatment or intervention may work. It's very different, but each of these philosophies are sufficiently fuzzy in their definition to allow a lot of interpretation. And that's it. I had 30 minutes. We had a 350-year journey, which was quite fast, but it was a very interesting meeting.